Hey guys, my name's Sam and welcome to Prep Medic. In this week's video, I have my wife, Susie, here with me, and we're going to be interviewing her about her career path to becoming a medical doctor. So in this week's video, we're going to talk through kind of how she got to where she is and any advice she has for somebody going into the medical field. So like I just said, I have my wife, Susie, here. Susie is 8 months pregnant and was gracious enough to come on the channel to talk about her career path to becoming a physician. So Susie, if you wouldn't mind just telling me about what your current qualifications are, where you are in the process of being a physician.
Yeah, so as soon as you graduate from medical school, you qualify as a physician or a doctor. That's when you get your medical degree and you can essentially go out and practice medicine. Most people choose to complete a residency program because that will allow you to get board certified in a specialty. And so it's a lot harder to get hired without having additional training. Currently, like Sam said, I'm in my third year of residency training as a pathologist. It's a 4-year program, so I have 1 more year left after this, and then after that I'll continue on and do at least 1 or 2 fellowship years of training as well. After that, then I'll try to get an official job working as a pathologist.
So obviously I know because I've been there for a while for pretty much this entire process, but the path so far, you start in undergrad, right? You got your undergraduate degree, and what did you major in for that?
So my undergraduate degree is in mathematics, actually, with a minor in, or with the emphasis in chemistry and a minor in psychology. And then I actually got really interested in medicine initially through the emergency medical technician program at the local hospital where I was completing my undergraduate training program.
Okay, cool. So then once you get through your undergrad, obviously you have to meet a bunch of science prerequisites before you can go in. And then you take your MCAT exam, which is like the standardized test to get into medical school. The next step is medical school, correct? And what does that all entail?
So to get into medical school, like you said, you have to have all of these prerequisite requirements. So if you have a non-traditional major, you will have to complete additional courses. I took several classes over the summer, including physics, and you have to spend a lot of time studying for the MCAT exam. That's a big prerequisite to get into medical school. Then I just applied pretty much all over the country to various medical school programs, got offered interviews, and then you complete your interviews, and if you're lucky, you get offered a position to start your medical school training.
Did you get in on your first application process, or did it take a little bit of persistence?
It took some persistence. I actually did not get in the first year I applied. I have great grades and everything. My MCAT score probably wasn't the best the first time around, and I didn't have very much medical experience. So during that transitional year after I had graduated undergrad and before I was able to get into medical school, I spent some time working as an EMT. And then also I worked as a phlebotomist at a local plasma donation center as well.
Okay, so when you're in medical school, like what does that training look like? You know, obviously it's kind of a feared school in academia. It's kind of like the most prestige and everything, but what does that look like? How did that go for you? And then what's kind of the process from there?
So a little thing that a lot of people probably don't know is that once you get into medical school, the school really wants you to succeed. So they're going to do everything they can to support you through it. So as scary and intimidating as it seems, there's a lot of support and resources available for you to help you get through it. Every school is a little bit different as far as their structure and how they're set up for training. My school was structured with a 2-year didactic training program, as well as following those 2 years, you would go out and do 2 years of clinical rotations where you're actually out seeing patients and rotating through different subspecialties to kind of get an idea of what specialty you actually want to go into. The first 2 years of didactics consist of pretty heavy credit hours. I think my highest credit hour semester was up to 32 credits. So you're pretty busy. You spend a lot of time studying.
That's in a semester, right? 32 in a semester? Okay.
Yeah, so it's almost like double a normal course load of college credits. On top of that, I or with that, I don't think everyone had that many credits. I also chose to do a dual degree program, so I was also enrolled in the master's program for public health. So I also had some of those courses. They were all online, so it wasn't too hard to fit into my schedule, but it did increase my course workload.
Yeah. That was kind of a brutal 4 years, or at least the first two were really academic heavy. But I mean, I remember that it wasn't all in person. Like you had your labs and stuff in person, but a lot of times what you were doing is they would record all the lectures and the lectures were optional. But then you'd go back and you'd watch them on like 2 times speed at home and do a lot of your studying at home and maybe go in for, 4 hours a day or something like that to get some of the hands-on stuff they required. But it wasn't like it was all like you're at campus every day, all day.
Correct. And it really depends on your learning style. For me, I really liked being able to have the flexibility to pause my lecture, read up on things. And so being able to kind of guide my own learning was really good for me. Other people, however, couldn't focus at home, and so they really needed to be in class. So it was kind of nice to have both of those options available to the different types of learners. If you were in attendance, usually classes were from 8 to noon or so. And then afternoons you would have lab classes like your anatomy lab or your physical exam, clinical skills labs, things like that would be in the afternoon. So I really liked being home so I could watch the lectures and pause them.
So like with that, now you've gone through 4 years of undergrad. You had another year, but we're not going to count that. Then you had your 4 years of medical school. So we're at 8 years of schooling, like post-secondary education there. And then now you have to get into a residency program. So you graduate medical school and you are a physician, but you're not specialized. You're kind of this general physician that doesn't really have any one niche. What does residency look like? Is it like hard to get into residencies? Where does that go? How do you get into them?
Yeah, so again, that's really specialty dependent. So some residencies are a lot more competitive than others. Most places currently undergo a match program. So you apply to wherever you're interested in whatever specialty you're interested in, and then you get offered interviews. You go out and do all your interviews, and then after that, you submit a rank list where you list your top however many programs you want to, and then all of the programs submit their own rank lists, and it's a computer algorithm that ends up matching you with your best fit and with what the schools chose as well.
So is that a pretty competitive process? Like what is that based on?
So getting into residency is really dependent on your experiences during medical school. Do you have a lot of leadership roles? Have you done volunteer projects? Have you completed any research? All of that goes on your application, as well as a personal statement and letters of recommendation. So I think the biggest factors actually are your letters of recommendation, as well as what you're writing about of your experiences during medical school in that application that programs usually rely heavily on for choosing who to interview. And then after that, once you've got your foot in the door and you complete your interview, a lot of it then goes on to if they think that you're a good fit for their program based on your personality and how you interact with them on your interview day.
Yeah, so it sounds like so many things like EMS and other healthcare jobs, like how you do is important and you can absolutely succeed if you don't have those connections, but there is absolutely that relationship aspect that if you don't have good relationships with people, it's such a small world, it's going to be exponentially harder for you. So it's kind of about who you know as well as just what you know on
Definitely.
that. So when you went in to be a pathologist. You got a pathology residency. That was your first pick. It's what you wanted to do. What is a pathologist? Because that's not a specialty that most people like think about or know a whole lot about. Heaven knows I didn't know a lot about it when you said you were going to apply for it. So what is pathology?
So a lot of people don't know about pathology because you don't get a lot of exposure to it during medical school. It's more of a elective rotation, and so if you don't choose to pursue it, then you might not be even aware that it exists. However, a lot of your teachers are potentially pathologists. They do a lot of the medical education, and then after that, once you're in training to become a pathologist, you can go down different routes. Most pathologists, I would say in general, are anatomic pathologists, and so you typically, it's kind of similar to radiology where you're looking at images most of the day, but instead of looking at black and white x-rays and MRIs or various imaging studies, you're looking at tissue under the microscope that's stained with different colors, and you try to come up with a diagnosis based on tissue that has been removed from a patient. There's also clinical pathologists, and those pathologists are more geared towards laboratory medicine, and so they basically make sure all of the labs in the hospital are running efficiently and correctly. They validate all of the testing that goes on for patients. They would be the ones who are in charge of setting up assays for COVID testing, things like that. Is all run by clinical pathologists. They also are in charge of running the blood bank and making sure transfusions are safe for patients. So there's actually a very wide range of roles and responsibilities that you can perform as a pathologist.
Cool. It's kind of like, your internal med doctors. You go in and you can be your hospitalist, you can be a cardiologist, and you can kind of branch from there. So you go through your basic residency, so that's another 4 years. Now, not every residency is 4 years. Emergency medicine, family medicine, I think internal medicine, those are all 3-year residencies. Pathology is 4, surgery is 5.
General surgery is 5.
So obviously there's a range of how long that is, but now we're at basically 12 years of schooling. Now you are getting paid in residency, but it's not what you would make as an attending physician.
Correct.
What's the next step after residency, and do you have to do it? Is that something everybody has to do, or just you?
Not everyone has to. After residency, a lot of people choose to find a job in their specialty, especially things like family medicine or emergency medicine. It's pretty standard to get a job right out of it. However, you can pursue additional opportunities such as fellowship training, which can be different lengths in time as well. So for example, if you wanted to go into cardiology, you'd have to do additional training after your internal medicine. And I think those programs can be up to 3 additional years of fellowship training. For pathology, fellowship training is 1 year in duration. You can choose different subspecialties within pathology and complete 1, 2, 3, however many fellowships you want to, essentially.
How many are you doing?
I'm planning on doing 2. So another 2 more years after this.
So we've gone through your background and kind of where you're going with this, but going on to more general advice for people that are looking at the medical field and trying to decide, hey, do I want to be a paramedic, a nurse, a physician, radiology tech, all of those things. What kind of a person do you think would be successful as a physician? Who do you feel would be most successful in medical school?
So that's a really good question. I think that one of the biggest things is being self-motivated. If you're not engaged and interested in learning and giving back to the community as a physician, then you probably won't be successful because no one's going to be holding your hand or spoon feeding you through the process. It really has to be driven by your own motivation and drive to learn this material and become competent in it so that you can be an effective physician once you're through your training.
Yeah, it's a long time, and I think, just from my experience with you, your friends, people we've known through the process, is it's so long that you absolutely have doubts through it, no matter how motivated you are. There are times where it just feels like it's never going to end. It feels like it's never going to end right now. We've been in it for so long, but you've been in it for so long. But with that, who do you think shouldn't go to medical school? Who's somebody maybe going in for the wrong reasons, or who shouldn't be doing this?
So if you're going into medical school for the wrong intentions, such as prestige or money, that's not going to keep you satisfied throughout your entire career. So really doing it because you're an empathetic person and you can relate to others, I think is a really important foundation to have before you go into medical school. Also having self-worth and confidence that all of this time and money that you're investing into yourself is worth it, and that you believe in yourself that you can do it.
So what tips would you give somebody going into medical school?
That's a great question. I have a lot of great tips. So one thing that really helped me was going through material beforehand. And so My teachers would hand out material ahead of time, and you could choose to go through it or just hold on to it and not look at it before your didactics. For me, just going through all of that content before I was even introduced to it by the teacher really helped it make more sense when they were actually going through it in person. And so that's one really good piece of advice, as well as the fact that you're going to be getting so much material thrown at you all at once that if you are procrastinating or putting things off, then that can really get overwhelming really quickly. So that was just one way for me to stay on top of all of the material by being just keeping ahead of it. Another tip I have that I think is really essential for anyone going into medical school is having a strong support system. You're not alone going through this. So if it's friends that you meet in medical school, family,
Great husbands.
great husbands, pets, anything like that that you can lean on, and when times get really hard, is something that you're going to want throughout the process.
For you, what was the hardest part of medical school and now residency?
So the hardest part of medical school and residency, I would say for both, is the constant transitions. You are going through this material so quickly, you're changing topics, you're changing rotations, so the expectations are constantly being altered, and you're in new places all the time. It's really hard to get in a routine or get comfortable with anything. You're kind of always on your toes, always trying to learn and impress somebody. So that's been the most difficult part, is just managing that stress and constant changes that are going on throughout the entire process.
Yeah, and it feels like we haven't really had the ability to kind of control our destinies for a while. Like, you can put in where you'd like to match for residency. You can have an idea of where you want to apply for medical school, but a lot of times it's just kind of wherever you get in or wherever you match, and we've been really fortunate in that. But it's just been a lot of moving around. Like every time we go somewhere, there's almost a time limit on how long we're there, and that wears over that period.
Yeah, and there's a lot of unknowns throughout the whole thing where you're not sure if you're going to get in, if you're going to match, if you're going to get a fellowship, if you're going to get a job afterward, where can you get a job? All of that is all really up in the air. So I'm looking forward to finally having somewhere where I can settle down a little bit more.
For sure. We've all seen Grey's Anatomy, Scrubs, House, or something, where we see physicians going through their residency program, and they all have a different kind of take on that. Meredith Grey is taking bombs out of people on a daily basis and stuff like that. What is involved with residency? What are the hour requirements? Is yours the same as somebody else's?
Not necessarily. There's a lot of differences between what specialty you choose to go into. You are given a lot more responsibility in general as a resident compared to being a medical student. You are the one in charge of taking care of your patient at this point. It's your job. You're getting paid to do that. And so the expectations are a lot higher, and you basically need to put in whatever time that it takes you to be able to effectively perform your job. So in pathology, we have more of a standard 9 to 5 type schedule, whereas other specialties will have more 12 hours or 24-hour shifts, a lot of call time, so you're still putting in time outside of your typical work hours. For me in pathology, I spend a lot of time still outside of work, studying, reviewing cases, reading up on the literature, or completing research projects, things like that. So even though the hours may seem more standard, they're actually still pretty heavy. So I would say definitely choose your specialty based on what you love, and not based on if you think it's going to be easy or better hours.
Cool. So the last thing I want to touch on, and obviously kind of a touchy subject, something that we keep private in our general lives, but talking about salary and pay, one, what does it cost to go through medical school? Of course, ish. And then when you get into residency, about what are you making? And then what's the attending salary range that you're looking at?
Yeah, so medical school is really expensive. We had to take out a significant number of loans to be able to pay for medical school, as well as you still have to support yourself with your housing and food and living expenses throughout all of medical school as well. So I was lucky enough to have Sam here helping out with his job because I couldn't work a job on top of medical school. So that's something to be aware of before you dive in, is that it's a heavy financial strain. And then after medical school, when you are a resident, you are getting paid. It depends kind of based on where you are in the country. Some places will pay you more because it's a higher cost of living, but then again, it's a higher cost of living. So here in Colorado, you make between $50,000 and $70,000 a year based on what program level you are in your training. And then you get a raise every year, so that's at least something to look forward to. And once you're done with training as an attending, you can expect to make, it depends on the specialty again, but ranging from 100 to, if you're like a neurosurgeon, like $700,000 a year, something like that. So it's a pretty wide range, and it depends on if you want to be full-time or part-time, what type of benefits you want to be in, if you want to do academics versus private practice jobs. So it can be quite variable.
Yeah, and excluding like the super lucky med students that had, well-off parents or, something that helped them out, it seems like most people graduate medical school between like 100 and 350,000 in debt. That seemed pretty average. So it definitely takes a while to get that. And then through your residency, that's accumulating. You can't defer your interest through residency, so that is always accumulating on top of that. Even if you have a support system to pay for some of it.
Correct. Yeah, the interest rates can be pretty high on the loans, so it can be pretty stressful to try to start paying those back when you're still on a comfortable salary. But it's definitely something that's a little bit trickier to balance now that you're having to pay back your loans as well.
Cool. Well, thank you so much for coming on the channel. I hope you guys found this helpful. If you guys have any questions, leave them in the comments down below. I'll try to include Susie in answering some of those if you have anything specific to medical school residency, becoming a physician. So I will see you next week.